Good morning, everyone. Thank you for convening today for the discussion on my project. This is Dr. Hiba Basmaji, the Learning and Development Consultant. The topic of my project is the educational instructions for parents on safe sleep practices of neonates and infants. According to the Center for Disease Control and Prevention, CDC, each year in the United States, there are approximately 3,400 cases of sudden unexpected infant death, SUID. In 2020, these deaths included roughly 1,389 due to SIDS, about 1,062 attributed to unknown cases, and approximately 905 caused by accidental suffocation and strangulation in bed. Multiple objectives and goals can be aimed out of this project. Some of the proposed ones are educating parents about safe sleep practices, as we will furnish them with evidence-based guidelines that promote the healthy development of their children. This approach will result in improved patient satisfaction, bolster our reputation in the market, and attract more patients to Emirates Hospital Group. Our commitment to providing exceptional knowledge and support, especially to new parents, will foster a sense of community support. The hospital recently encountered a distressing situation where parents of recently discharged healthy infants had to rush to the emergency department. Their infant arrived via ambulance, appearing bluish, pulseless, and without breathing. Despite the caregiver's best efforts to save the baby, tragically, the infant did not survive. After a thorough examination, the hospital's neonatologist identified the case as Sudden Infant Death Syndrome, SIDS. In response to this heart-wrenching incident, the hospital's team of neonatologists, in collaboration with senior management, had launched the Patient Education Project. This initiative has been entrusted to the Learning and Development Department to help raise awareness and prevent such tragic occurrences in the future. As mentioned earlier, this project will serve multiple purposes. It will offer parents with evidence-based safe sleep guidelines. By adhering to these guidelines, parents will be equipped to safeguard their infants against the risk of sudden infant death syndrome, SIDS. It will focus on aggregating trustworthy, evidence-based information regarding the best practices for infant safe sleep, eliminating myths, misconceptions, and legends from the equation. It will enable parents to implement the guidelines confidently and without hesitation. It will enhance nurses' awareness of safe sleep practices. This knowledge can be applied to the care of infants and neonates in our facility. It will improve patient satisfaction, bolster our reputation in the market, and attract more patients to Emirates Hospital. It will foster a sense of community support as well. The intended audience comprises mothers and fathers of infants aged less than 1 year who have been admitted to the nursery, neonatal intensive care unit in ICU, or any other family members or caregivers responsible for these infants. These individuals will utilize the IPTV, inpatient TV screens, throughout the duration of their hospital stay. Furthermore, the same educational session, which is integrated into the website, will be made available to the same demographics in case they were not able to attend the session during their hospitalization. Additionally, it will be accessible to any other parents who visit the website and seek to benefit from this valuable information. Upon successful completion of the instructional program, parents will attain the following outcomes. They will attain a thorough comprehension of safe sleep practices, completely debunking any prevailing myths with a 100% success rate. They will expertly apply their acquired knowledge in the care of their newborn, achieving an accuracy rate of 100%. They will skillfully communicate and share their newfound expertise with others, demonstrating a proficiency level of 95%. Measuring the success of this project hangs on two critical factors: full completion and gathering feedback from parents. The project's primary objective is to equip parents with the knowledge and skills needed for safe sleep practices. Therefore, its success is contingent on patients effectively applying the instructional content and providing positive feedback when surveyed for their satisfaction. Additional success metrics extend into the long term, particularly in the form of reducing the incidence of sudden infant death syndrome (SIDS) among infants. For this project, I'm intending to create it using the Canvas program, incorporating visually appealing slides and user-friendly navigation for an enhanced learning experience. The program's content will feature branching scenarios and mini quizzes requiring parents to use a TV remote to answer questions and advance to the next slide, enhancing engagement and understanding. Recently, we have introduced an interactive IPTV screens in our inpatient rooms, resembling hotel screens that display patient names and relevant information upon room reservation. This interactive screen also provides crucial information such as patient rights and responsibilities, point-of-care tests, and infection control protocols, which patients can conveniently access using the TV remote. During our discussions, we reached a consensus to include educational sessions on safe sleep practices as one of the topics on this interactive platform. Parents of infants under 1 year of age will be directed to those online sessions during their hospital stay by physicians visiting their infants. As parents of newborns finalize the instructional program, a nurse and a neonatologist will facilitate a practical session where parents can apply their newfound knowledge in a simulated environment, ensuring a clear understanding and ease of application. During this session, parents will have the opportunity to ask any questions they may have, with the neonatologist providing support. This interactive session will be available to parents who attend the program during their hospital stay. For parents who were unable to attend the session during their hospitalization, the instructional program will be accessible on our online website. We will provide contact information for a physician who can offer assistance and clarification. Additionally, Zoom meetings with the neonatologist can be scheduled for those who require further guidance on safe sleep practices. Now, let's discuss the project timeline. First, the project kicked off will commence immediately following approval. The research and analysis will be completed by October 15th. The design and development stage will be undertaken in the first week of November. The quality assurance will be carried out by mid of November. The deployment and launch are scheduled for the end of November. The post-launch support and evaluation will be conducted by the end of December. Please note that these dates are subjected to potential adjustments pending further discussions with subject matter experts and project sponsors. Now, who is on the project team? Okay, I will be serving as a learning and development consultant specializing in project management and establishment. Mr. Bilal Muhammad, he will hold the role of IT manager and is responsible for offering technical support concerning the online intranet system. Ms. Majdulin, the learning and development manager, is available to provide support and answer questions related to the program. Dr. Agatha, the neonatologist, will be responsible for delivering the instructional content of the project. Mr. Varun, working within the marketing department, will be tasked with marketing the final product and assisting with design and logo-related support. Thank you for your time today. To recap, Our project aims to educate parents on evidence-based safe sleep practices for their newborns. I appreciate your consideration and I'm eager to hear your thoughts and answer any questions you may have. The next steps involve your sincere, supportive decision on project approval. I firmly believe that this project will benefit our patients, organization, and community as well, and I look forward to the possibility of working together. If you have any questions or need more information, please feel free to reach out to me. Thank you, and I'm excited about the potentials ahead.